So this video is going to be demonstrating a deep tie, and appreciating that the boards of Ethicon are very nice to provide to programs. Just understand that this aspect of the device is relatively weak, so just be careful. We're going to do this as a one-handed tie, and I'm going to use my right hand as being dominant. And for the purposes of today, I'd like you to take your needle driver and just clamp your purple string. Imagine that this is your needle, and it's basically keeping it out of the way for you, but it's still remaining on your surgical field. So with your right hand being dominant, you're creating that C, picking up both the white with the thumb and the index finger, taking the purple and pushing it away from you over that index finger, drop the index finger down, pick up the white, allow it to go through the hole. And with regard to a deep tie, you're always keeping upward tension on your left hand while you're pushing tension down into the wound with your index finger. So it's important to use your index finger. You can actually still see the deep aspect of your patient here when you're pushing down with your index finger. Conversely, if I was to change this and use my thumb to push all the way down, number one, I'm using a shorter digit, but number two, now the entire palm of my hand is in the way and I cannot see those deep structures on my patient. So always be pushing down with your index finger. Completing the second half of that one-handed tie, again, you're grabbing that between the thumb and the index finger, putting tension over the pinky as we do that karate chop movement. You're going to take the purple toward you, drop it down, pick up the white, pull it through the hole, and again, continuing to pull upward tension on the left hand as we are going to walk that white string down into the hole with our right hand, okay? Again, not using the thumb, get that thumb out of your way, use your index finger. Now your needle, you'll notice here, is maybe moving around a little bit, but it's still going to be clamped within your needle driver. So the nice thing is that it's not flopping into your surgical field and then potentially causing risk for harm to either you or anyone else who's around the table. One more time for that one-handed tie with the right hand being dominant. Again, making your C, pulling it over the finger, taking that purple away from you on the index finger, dropping down, picking up the white, ice cream cone as we pull through the hole. Upward tension with that left hand as we're going to walk that down with the right. Now this is difficult because it is yarn. However, on normal suture material, this will glide right down. Even on a braided or a multi-filament suture material, this will walk right down as long as you're holding upward tension with that left hand and pushing downward tension with your dominant hand, which here is the right hand, and using that index finger. Grabbing it with the thumb and the index finger here, karate chop, pulling it towards you over the middle finger, bend the middle finger, bring it down, pick up the white, pull through, and again, upward tension with the left hand as we walk that thread down with the right hand. And that completes a deep instrument tie or a deep hand tie when you're in a very tight compartment on the patient's body.